You have to master topic 8.3 on the thickness of atrial and ventricular walls, or you're honestly risking the easiest marks on your Cambridge Biology A-level exam. Let's get right into it.
So, imagine you're sitting in the exam. You calculate the wall thickness, you write down the answer, 4.5. Wait, what did this student just do wrong? I mean, they crunched the numbers perfectly. They even used the right formula. But they just made the single most common, literally devastating mistake you can make on this paper.
0 marks. The grade boundary risk here is incredibly high. See, this simple omission of units, writing just 4.5 instead of 4.5 millimeters or micrometers, completely destroys candidate scores. According to the principal examiner reports, students are throwing away entire grade boundaries just by leaving the unit blank. Imagine losing your A star because you forgot 3 little letters. No way, we're not doing that.
All right, moving into Section 1, the method mark strategy.
To make sure that never happens to you, we need to use the actual procedural framework that top-scoring candidates rely on. This isn't just basic revision. This shows you exactly how Cambridge examiners think. You know, they aren't just scanning for your final answer. They actually award crucial marks for the analytical process itself. So, Step 1, deconstruct the question. Step 2, extract the relevant data from whatever stimulus they give you. Step 3, select your analytical framework. Step 4, execute with clear notation, and hey, this is exactly where you double-check those units. And finally, Step 5, present your answer with the correct terminology. If you follow these 5 steps, you are actively harvesting method marks, even if your final calculation somehow goes a bit off track.
Let's look at Section 2, core concepts and cognitive domains.
So why do so many of us struggle with the complex data and graphs for atrial and ventricular wall thickness? Well, it really comes down to cognitive domains. The examiners are testing 3 specific things: your knowledge and understanding, your handling and evaluating of information, and your experimental skills. For topic 8.3, the whole academic benchmark prioritizes analytical depth over just superficial breadth. You can't just memorize that the left ventricle is thicker than the right. That's not enough. You actually have to evaluate data tables that compare those thicknesses across different species, or maybe under different physiological conditions, and then interpret what that data is actually telling us.
Now hang on, because in just a minute, I'm going to reveal the one specific examiner clue that transforms a totally 0-mark descriptive answer into top band gold. But first, you absolutely need the framework that makes that clue obvious, because without it, you'll see the clue on exam day and walk right past it.
Which brings us to Section 3, navigating complex exam data.
The real trick here is how we handle complex exam statistics. You're absolutely going to face statistical analysis in this topic, for sure, and you have to know which statistical test to select based on the data they throw at you. Are you comparing the mean ventricular wall thickness of athletes versus non-athletes? Boom, that's a t-test. Are you looking at categorical data? Okay, that's chi-squared. Or maybe you're tracking the relationship between body mass and atrial thickness across different mammals. Well, that requires a correlation test. Selecting the wrong analytical framework here is like an instant cap on your marks, so we've got to get this right.
And honestly, this brilliantly illustrates the need for evaluative thinking. What does that mean? It means you're questioning assumptions, you're considering different perspectives, and most importantly, you're justifying your decisions with solid evidence. Higher order assessment in topic 8.3 demands that you move way beyond basic descriptive responses. You aren't just reciting facts like a textbook. You are evaluating alternatives, comparing experimental approaches, and writing justified conclusions based entirely on the evidence they put in front of you.
Okay, let's jump to Section 4, the Spot the Error Challenge. Let's see how you do.
Let's test that evaluative thinking right now. I'm going to escalate the stakes with a classic Cambridge-style past paper scenario. Look at these 2 answers explaining why the left ventricle is thicker. The flawed answer says the ventricular wall is thicker because it pumps harder. Let's be real, I see this all the time. It sounds totally logical, right? But actually, scratch that, it's a GCSE answer. It's going to earn exactly 0 marks at A level. Now consider the top band answer. The left ventricle wall possesses greater muscle mass to generate higher hydrostatic pressure to overcome systemic vascular resistance. You see the difference there? We replaced thicker with greater muscle mass. We swapped out pumps harder for generate higher hydrostatic pressure. And we added the vital specific context to overcome systemic vascular resistance. Guys, that is exactly how you demonstrate logical, structured reasoning.
All right, Section 5, examiner warnings, the top 3 mistakes.
So we literally dug through the Cambridge Principal Examiner reports for topic 8.3, and the data on where students mess up is kind of shocking. Here are the top 3 fatal mistakes. Number 1, like we talked about right at the start, forgetting units and calculations. It is such a tragedy to lose marks on math that you did perfectly. Number 2, confusing key terminology. And number 3, providing answers that just aren't specific to the given context. Look, if the question gives you a graph about a diseased heart and you write a generic, perfectly memorized textbook answer about a healthy heart, you get nothing. You have to apply your knowledge to their specific scenario.
And right here is the payoff to that clue I promised you earlier. This is an examiner alert straight from the source. Always define key terms before using them in extended responses. The reports show that candidates constantly confuse key terminology. So if you're writing an extended response about atrial systole, just take half a sentence to define it first. It's a simple structural habit, but it anchors your answer, it proves your foundational knowledge to the examiner, and it immediately shifts your response into the top mark band.
Finally, Section 6, the final evaluation check. To secure those marks in Topic 8.3, you've got to rely on the method mark strategy, use your evaluative thinking, ditch the generic phrasing, and please never, ever forget your units. Practice this approach on past papers until it's just pure muscle memory.
But here is the real catch. You've mastered the biological concepts now, right? You've got the structural framework for Topic 8.3. You know exactly what the examiners want. But what happens if you misinterpret the specific command words? You know, words like evaluate, explain, or describe. Those words actually dictate how your answer's graded. If you get the biology perfectly right but the command word wrong, you still fail the question. To solve this exact problem, you have to know how to decode those words. Make sure to subscribe to our YouTube channel, Ace the Exams, at acetheexams_IGCSE so you can absolutely crush your Cambridge exams. Click the explainer on your screen right now to master the command words that decide your final grade. You really can't afford to skip it. I'll see you over there.